Insight, innovation, and inspiration. Welcome to our YouTube channel EarthRx. In this video, I am going to explain the anatomy of respiratory system for the batch who is going to appear for RGHS final exam first year. So in this video, I am going to take on the only important topics and what are the content which students should write in the exam. So first, according to NCSM syllabus, there is a in the respiratory system enlist the parts of the bronchial tree, and it is a much easiest question because you can the parts of the respiratory system, if you want to enlist, it will going to given marks, but it is I feel it is not in that much of important question. But uh, I don't want to waste your times because you don't have a time. Because of this time I am going to little bit speed. So here directly we go to the difference between right lung and left lung. So as you know that when the air is enter into the nasal cavity through a nostril, as you can know, the air is enter into a nostril, and it is enter into the nasal cavity, then through a larynx it is going to the trachea, and this the again you know that enter into the lungs to again alveoli, it is going to the gaseous exchange in between the lungs and the blood. So there is a mechanism, you already know that in PUC you can already study. So here the exam point of view, you have to learn about the lungs. So you in the lungs there is a important it is mainly you in the exam you should write about the lungs. So mainly they are asked for difference between left lung and right lung, but before that, if they ask for lungs, explain lungs in for a whole for a 10 marks, you need to explain all the things including left and right lung difference. So coming to introduction part, it is to see. So it is one of the paired organ, as you know that. So as already know you, the lungs are the paired organs which are lies in the thoracic cavity, and they are separated each from mediastinum and the heart. So what is the shape of the lungs? You can see in the image. It is a cone shaped organs. So the location of thoracic cavity is exactly uh, lies in the thoracic cavity. So it is a important organ in the exam. It is going to ask for 10 marks. So in 10 marks, how much of you going to write in the exam is simply for 10 marks you are going to write this much of content. So you're going to write then shape, location, and appearance. It is a porous, elastic, and spongy in nature. So it is the mainly color. It is the brown or gray in a young age, and gradually it is going to converting a black color due to deposition of inert CO2 carbon dioxide particles. So around it is the weight of right lung is going to be 700 gram and the left will be 600 gram. There is a difference of 100 gram because of the left side there is a notch called cardiac notch. That's why it is going to vary. So in the lungs, the external features are it has an apex, base, and the three borders. So as in image you can see the apex, it is apex, and the base, apex, base, on the borders, three borders, anterior and posterior and inferior. So here see students in this content, mainly they are focus external examiner are going to focus on that borders and surface, mainly the main contents. So here there are three borders in lungs and two surfaces in lungs. So those are three borders, anterior, posterior, and inferior one. So in image you can see the you can you can't see the borders in this. Another one is image is there. I have anterior border and there is a posterior border. If you hold in a proper way, you can feel that the border and the inferior border one. So these are the three borders, and the surfaces are coastal surface, which is towards the ribs and medial side. Medial is the medial surface is another one. Medial surface is towards the mediastinum. So as an apex, if you want to elaborate the little amount of an answer, so explain about the borders, apex, base, each one by one in a two or three sentences. As like an apex, what is an apex? It is a blunt lies above the level of anterior end of the first rib. So you know the first rib where it is lies. So above the first rib it is going to be lies. It reaches nearly 1 inch above the medial one third of the clavicle. It is covered by cervical pleura. It is a simple thing. So and the base, where is the base is placed? You know how the lungs is already in your dissection. You already know that how the lungs look like. So it is a semilunar, concave, and resting on the diaphragm. Due to presence of diaphragm, it is in the concave shape. The concavity is deeper on the right side due to higher position of the right dome of the diaphragm. So due to presence of the right dome of the diaphragm, it is more concavity in the right side. So you can easily can remembering the things by imagination. By writing you can't do anything. So by writing only in sake of exam you can memorize, and afterwards you will be forgotten. So better to imagine and start studying. It is the best way. On both the side, the base is related to the corresponding part of the diaphragm separated by pleural sac. So below the diaphragm, the base is related to the right lobe of the liver on the right side and the left lobe of the liver. So in the exactly below the diaphragm, the base related to the right lobe of the liver on the right side and left lobe of the liver, fundus of the stomach, spleen on the left side. Simple. This much relation if you write in the exam, it will be going to look good, and examiner will think this student is know all the things, and he will going to give a marks, good marks, and he will take a good marks. And anterior border, in come to borders, there are three borders. Listen carefully: anterior border, posterior border, inferior border. Simple. So anterior, it is a thin border, it is shorter than the posterior border. So anterior border of the right lung is almost vertical, whereas an anterior border of the left lung shows wide notch below the level of fourth costal cartilage called cardiac notch. Simple it is. So anterior border is what? It is shorter than the posterior border. So and the anterior border of the right lung is there and left lung is there. So anterior border of the right lung is almost vertical, as you can see in the image. It is vertical, and in the left shows wide notch. You can see the notch in the left lung due to the presence of cardiac notch in the dexterally at the fourth costal cartilage. So come to posterior border. What is posterior border? It is the thick one, and the anterior is thin one. It is ill defined. You can't going to define, but it is extend from below the 7th cervical spine to the 10th thoracic. So C7 to the T10th. This much of area is covered. Inferior border, it is separated from the costal and medial surface. So it comes across into surfaces. Surfaces are two surfaces: coastal surfaces and medial surfaces. So coastal surface, it is large and convex, covered by coastal pleura. Simple. Medial surface is again we are going to divide into posterior and anterior. So posterior is also called as vertebral, because in the behind there is a vertebral are there, so it is closely related to the vertebral bodies, so it is called as vertebral part. So anterior are also going to call mediastinal part. It is closely related to the mediastinum and the heart. It has hilum. So what are the fissures? It is the main point with where they are going to differentiate between left lung and right lung. Those are fissures of the lungs. So oblique fissure and horizontal fissure. So so in the image I will show that oblique fissure is present in both the left lung and right lung. So you can see the oblique fissure in the right side, and left side is also there. There is a one exception: horizontal fissure is there, it is in the right side only, it is not seen in the left side. So oblique fissure is a prominent fissure present in both the right and left lungs. It begins at the location you have to mention. It is begins at the posterior border of the lung, about 6 centimeter below the apex, and runs downwards and forwards to emerge on the anterior most part of the base. So come into horizontal fissure. It is present only on the where? Right lung. So it extends from the anterior border to the oblique fissure at the level of fourth costal cartilage. Right. So come into lobes of the lungs. What are the lobes present in the lungs? So in the right lung, it is divided into three lobes. Due to presence of these fissures, it is going to divide one by one. It is called as lobes. So in the right lung, there is a lobes called upper lobe, middle lobe, and lower lobe. So in image you can see in the right lung, this is upper lobe, and middle lobe, and this is the lower lobe. So this much you should know. In the left lung, it is divided into two lobes by oblique fissure. It is by oblique fissure. So it is only two lobes are present in the left upper lobe and another one is lower lobe. So the left lung shows the tongue-like projection below the cardiac notch. Called it is called as lingula. You can see the tongue-like projection. It is called as lingula. So what is the difference, mainly difference between hilum and the root of the lungs? So in the image you can see where is the hilum present, here you can see the hilum. So hilum and the root of the lung, what is the difference? So root of the lung is mainly it is the what are the entering or leaving structures where present, it is called as root of the lung. Exactly at the hilum, it is present at the hilum, but it is called as root of the lung due to presence of the entering and are leaving the structures. So what is hilum? It is the hilum, it is a large depressed area that lies near the center of the medial surface, called as hilum. It is the difference. So in this question there is a separate, you can ask, they can ask for 5 marks, explain root of the lungs. For my 5 marks, it is there, they are going to ask for this question, root of lungs. So what are root of lungs? Root of lung is a short broad pedicle which connects the medial surface of the lung and mediastinum. It is formed by structures which either enter or come out of the lungs at the hilum. Exactly at the hilum, what are the structures which are passed, enter or exit? This much you should understand. So the hilum lies opposite the bodies of fifth, sixth, seventh thoracic vertebrae. So this much, mainly focus on this content of a root of lung. So root of lung is made up of following structures. So see, principal bronchus on the left side and E partial and I partial bronchi on the right side. What are the content of root of the lung? So principal bronchus on the left side and E partial and I partial bronchi on the right side. So E partial on the right side and E partial on the right side, I partial bronchi on the right side, I partial on the bronchi on the right side. So in the left side you can see the principal bronchi. So coming to right one, there is a presence of one pulmonary artery, two pulmonary vein. If you, if the diagram you can, if you write in diagram it is also good, if you not write, otherwise if you explain it, it will also good. So and there is another one is bronchial veins, bronchial lymph nodes will be there, bronchial arteries, bronchus will be there. So pulmonary ligaments also there. So what are the main specific in the right lung and left lungs? So in the right lungs, E partial bronchus, you can see here above, remember that E partial bronchus and pulmonary artery will be there, one pulmonary artery, and I partial bronchus, it is in the below. So inferior pulmonary vein and superior pulmonary vein, there are two will be there. So in the left lung, it is the pulmonary artery. Where is the pulmonary artery? You can see here pulmonary artery in the above, and bronchus will be here, and inferior pulmonary vein here. So what is the relation of the root? It is also the important point. So anterior relation, what are the anterior relation? It is going to relation in the anteriorly with the phrenic nerve, pericardiophonic vessels on both the lungs, anterior pulmonary plexus on both the lungs, superior vena cava on the right lung only. Remember, it is superior vena cava on the right lung, a part of the right atrium on the right lung. Posterior relations, what are the posterior? There is a going to on the both lungs, there is a vagus nerve posteriorly, posterior pulmonary plexus on both the lungs, descending thoracic aorta on the left lung. Superior relations, what are the superior relations? Are terminal part of azygos vein on the right lung, arch of aorta on the left lung. So in inferiorly there is a pulmonary ligament, you can see in the image. So this much is important things. So another one is according to our NCSM syllabus. uh, So, what is the blood supply of the lung and nerve supply and lymphatics of the lungs? So, it is also very important things, because they are in the exam they are going to ask for 5 marks. If they are asked, you must write. So, on the right lung, it is supplied by bronchial artery. I will write this pen. Okay, a little bit above. Okay, right lung, there is an artery called bronchial artery. bronchial artery, and the left lung is supplied by two bronchial arteries. Left lung is supplied by two bronchial artery. So, deoxygenated blood is brought into the lungs by two pulmonary arteries. So, and oxygenated blood is returned to the heart by four pulmonary veins. So, here it is main important things. So, the deoxygenated blood, what is there in the, it is brought to the lungs by two pulmonary arteries, and the oxygenated blood pump uh, return to the heart by four pulmonary veins. This much is important. So venous drainage of the lungs. What are the venous drainage of the lungs? So I will write here. Take another one. Venous drainage. So bronchial veins and pulmonary veins are drained. So the bronchial veins, what is present? Sorry, it is a technical problem is there. Bronchial veins. These bronchial veins are drained into azygous vein, and the left bronchial veins drain into hemiazygous vein. So left bronchial vein is going to drain in the hemiazygous vein. So pulmonary veins, pulmonary. Sorry guys, it is pulmonary veins. These pulmonary veins, the greater part of the venous blood from the lungs is drained by pulmonary veins only. So it is completed. So lymphatic drainage of the lungs. There are two set of lymphatics, two sets of lymphatics drain the lung and pleura, both which drain into bronchopulmonary nodes. So nerve supply. What are the nerves supply? Sympathetic and parasympathetic. So in sympathetic, there is a spinal segments of T2 to T5. So and parasympathetic nerve is vagus nerve. This much. So here we can see the bronchopulmonary segments in the image. So these segments are no barriers to spread the bronchogenic carcinoma. So bronchopulmonary segment, usually the infection of a segment remains restricted to it. So although some infection like tuberculosis may spread from one segment to another. So coming to directly anatomy of the bronchopulmonary segment. So in the right side it is around a 10 bronchopulmonary segment, and the left is also same number, that is a 10. So each segment is a pyramidal in shape. You can see in the image. So it the apex directed towards the root of the lung, and each segment is connected by a connective tissue called there is a connective tissue. The connective continues on the surface with the pulmonary pleura. It is again going to connect with the pulmonary pleura. So the bronchopulmonary segments are independent respiratory units. The connective tissue septa between adjoining segments from intersegmental planes. Each segment has a segmental bronchus, segmental artery, autonomic nerves, and lymph vessels. So here we can clear that bronchopulmonary segments on the right side. So what are those? So on the right principal bronchus, it is divided into three lobar bronchi, that is superior, middle, and inferior. So as you can see in the image, it is uh, superior, superior, middle, and then inferior. So in the superior lobar branches, it is again divided into three segmental bronchi: apical, posterior, apical, posterior, apical, posterior, and so bronchopulmonary segment on the right side, it is there is a three division: superior, superior, middle, and then inferior. So superior is again divided into three, that is apical, posterior, and then anterior. So the middle lobar is again divided into two segmental, one lateral and another one is medial. So the inferior or lower lobe, it can be divided into five segmental. Those are superior, lateral, medial, anterior, posterior, and lateral. Another one is superior. So In the left side, the left pulmonary bronchus divided into two lower bronchi. One is superior and then inferior. So superior lobar bronchus is again divided into two main branches. One is cranial and caudal. So we can see bronchopulmonary segment on the left side is given superior lobar and cranial and caudal lingular branches. So cranial branches is given apical posterior and then anterior, apical posterior and then anterior. So another one is the lingular branches. It is given two segments, that is superior and then inferior. So inferior lobar branches is again given five segments, that is superior, posterior, anterior and then lateral. It is given. So the blood supply of the bronchopulmonary segment is supplied by tertiary branch of the pulmonary artery. So you can see a tertiary branch of the pulmonary artery, it is going to supply. So in the venous drainage, it is intersegmental veins drain adjacent parts of the adjacent segments. So intersegmental veins drains. So clinical applications are most important. Segmental resection of bronchopulmonary segments is possible as the independent anatomical, structural, functional, and surgical resectable units of lungs. Since there is a plane of separation between the independent units, segmental resection can be undertaken in cases of benign neoplasm and tuberculosis. Importance of bronchopulmonary segment in postural drainage. In some cases, excessive accumulation of secretion of bronchi may cause respiratory embarrassment and can lead to the infection. So drainage of fluid can be facilitated by placing the patient in posture that favors flow of such secretion by gravity. A good knowledge of bronchopulmonary segment and of the resection each bronchus is necessary effective use of the method. So this is about bronchopulmonary segment. So there is another one concept is called pharynx and the larynx. So what is pharynx? You know that pharynx is a funnel-shaped wide muscular tube. It is passageway of air and food, common for air and food. So for digestive and respiratory, it is the common way. Uh, so the location, it is present behind the nose, mouth, and then larynx. So what are the dimension? You can see the length will be 12 to 12 to 14 centimeter, and the 3.5 centimeter is upper border breadth, and the lower part will be 1.5 centimeter. So what are the boundaries will be present in the pharynx? Uh, Imagine superiorly, inferiorly, anteriorly, posteriorly, laterally. Common thing. So what is superiorly will be present? So superiorly we can see base of the skull or scaphoid bone. So inferiorly will be the it is esophagus at the level of C6 vertebra. You can see at the C6 vertebra. Then anteriorly it is prevertebral fascia can be seen as nasal cavity can also in the anteriorly. In posteriorly it is prevertebral fascia will be seen. So laterally it is tympanic cavity will be seen. You should know this diagram, otherwise you can leave it. So parts will be nasopharynx, oropharynx, and laryngopharynx will be the part. So I will upload in the notes. You can take that notes. Blood supply will be carotid artery and facial artery. Nerve supply will be pharyngeal nerve, and the venous drainage will be facial vein, and also jugular vein. So the pharynx parts will be, you can see nasopharynx, oropharynx, laryngopharynx. So in the nasopharynx, it is transmit only air. It transmit only air. It is the continuation of the nasal cavity. The auditory tubes open into this part. Oropharynx, it transmit both food and air. The paired palatine tonsils are located at the lateral level. So laryngopharynx, it is inferior to the oropharynx. Behind the larynx, it directs the air and ingested food into the respiratory and digestive passage respectively. So you can refer these notes. It is enough for you people, and they add some amount of clinical aspect like pharyngitis, adenoids. You can refer the book Manjiri, sorry, Dipali Nijavante book. It is best book. You can refer it. Otherwise, I will make a note of that. So there is a pharyngitis. So here you can see pharyngitis as a clinical aspect. It is the inflammation of pharynx, and adenoids are the pathological enlargement of the nasopharyngeal tonsil present in the nasopharynx is called as adenoids. Pharyngeal diverticulum or Zenker's diverticulum. So it is the primary cause of Zenker diverticulum is tightness or malfunctioning of the cricopharyngeal muscle. As you age, it is caused due to neuromuscular incoordination. Because of this, food and liquids have harder time to going down, passing into the esophagus. Material can get stuck in the pouch of throat. Aspiration, pneumonitis, dysphagia, regurgitation, hoarseness, and chronic cough. This other condition you can see. So tonsillitis, inflammation of tonsils in the tonsils present in the oropharynx are the site of frequent infection, especially in the children. So you can come into larynx part. It is the important topic which is going to ask for 5 marks. So larynx, I guess it is repeated in the 2023 batch, I guess. Introduction. So it is a cartilage organ which is present anteriorly in the neck. Production the voice is the function. So here larynx is an respiratory organ, one of the respiratory organ. It is lies between the root of the tongue and root of the tongue above and the trachea below. So at exactly puberty, male larynx grow rapidly, and it is become larger than female larynx. So it is also called as voice box. So location is in adult male. It is lies in the exactly in the uh, anterior midline of the neck in front of C3 vertebra, and in the children and female it is C1 to C4. So the what are the component will be. So the component relations, a component of relation can be seen. It is larynx is mainly made up of cartilage of the larynx, joints of the larynx, ligaments and membranes of the larynx, cavity of the larynx, muscles of the larynx. So what are the cartilage of the larynx? Cartilage of the larynx, it is there are two types of cartilages. One is unpaired and another one is paired. So unpaired is thyroid cartilage, cricoid cartilage, and epiglottis. So thyroid cartilage is consist of the right and left laminae. The lower part of the anterior border of the right and left laminae fused to form median projection called the laryngeal prominence or Adam's apple. Upper part of the anterior border do not meet. Uh, so again, it is cricoid cartilage. It is shaped like ring. It is a thicker and stronger than thyroid cartilage. It has two parts, arc and lamina. So I will upload a notes. You can take note that notes in a serious notes. I will share in my Telegram channel. You can refer it and you can study. So epiglottis cartilage is a tongue-shaped cartilage having broad upper end and narrow lower end. It is upper end is broad and free, lower end is pointed and attached. So cartilage is done. Then joints of the larynx. What are the joints are present in the larynx? So the joints are like this. Uh, so what are the joints present in cricothyroid cartilage will be there. Uh, it is the type of synovial joint articulating surface inferior corona of the thyroid cartilage and side of the cricoid cartilage. Just you can mention the joints of larynx like cricothyroid cartilage, cricoadenoid joint. So these you can also mention. Uh, don't go deep in this. Ligaments of the larynx, extrinsic ligaments and intrinsic ligaments. So membranes of the larynx is like quadrant membrane and conus elasticus. Cavity will be the cavity of the larynx extend from the inlet of the larynx. These are not required. Muscles will be there are some muscles which are important. Extrinsic muscles and intrinsic muscles will be there. So extrinsic muscles are those in which muscles are attached to the cartilage of the larynx and other end is attached to the neighboring structure. Extrinsic muscles are sternohyoid, thyrohyoid, inferior constriction of pharynx, stylopharyngeus, and palatopharyngeus. So intrinsic muscles are conflict laryngeal may be conflict according to the action. So blood supply will be laryngeal artery, superior and inferior one. Venous drainage will be laryngeal vein, superior thyroid vein, inferior laryngeal. So then nerve supply will be recurrent laryngeal nerve. So coming into pleura. Pleura is the covering. Each lung is enclosed by pleural sac. The pleural is a serous membrane which is lined by mesothelium. So what is pleura? It is the last topic of this respiratory system which is going to be asked, may or may not be asked. So you can see. So there is a layers: cervical pleura, visceral pleura, mediastinal pleura. So what is this? Let's see. So layers of pleura. So there are two layers in this. One is visceral and parietal pleura. Visceral is also called as pulmonary pleura and parietal pleura. So visceral pleura, what is this? It is a thin and firmly adherent to the lungs over all its surface features except that the hilum. So give the lungs and smooth shiny outer surface. So in parietal, what is it happened? It is the thicker one than the visceral pleura. The parietal pleura lines corresponding half of the thoracic cavity thereby cover the diaphragm, thoracic wall, and the mediastinum. So again, parietal pleura is again divided. So parts will be seen as costal pleura, diaphragmatic pleura, and mediastinal pleura, cervical pleura. So costal will be the one which is inner surface of the sternum and ribs, intercostal space, sets of the vertebrae bodies. So diaphragmatic means superior aspect of the diaphragm will be attached. Mediastinal means corresponding to the surface of the mediastinum. Cervical means it is in the extent to the neck. Pulmonary ligaments are will be there. Parietal pleura surrounding the root of the lung extend downwards beyond the root of the lung. It is called pulmonary ligament. So clinical aspect will be there. Pleural effusion first visible in the region of the cardiodiaphragmatic recess, as it is the most dependent part of the pleural cavity. The presence of 300 ml of fluid in the cardiodiaphragmatic recess in adults is sufficient to enable its clinical detection. So come here, though there is some points about visceral and parietal pleura. It is thin, it is thick, firmly attached, loosely attached, does not have parts. It is a four parts: diaphragmatic, mediastinal, costal, cervical. It is line surface of the lungs, including fissures. It is insensitive to pain. It is the outer layer developed from. So these are not required. You can refer about that. So pleural cavity, blood supply, parietal pleura, intercostal artery, internal thoracic artery, musculophrenic artery, visceral and pulmonary pleura, branchial arteries. Venous drainage will be esophagus vein as it is. Visceral pleural, it is a branchial veins. Lymphatic drainage in parietal pleura, it is intercostal, internal mammary, posterior mediastinal, diaphragmatic nodes. In visceral, it is drained by bronchopulmonary lymph nodes. Nerve will be parietal pleura will be phrenic nerves. Uh, Visceral will be autonomic nerves. Main thing. So clinical pleural effusion, pneumothorax, hemothorax, pneumothorax, emphysema. Pleural effusion means it is a collection of fluid in the pleural cavity. Pneumothorax means air in the pleural cavity. Hemo means blood in the pleural cavity. Hydro means water in the pleural cavity. Emphysema means collection of pus in the pleural cavity. Pleuritis, it is inflammation of the pleura. Dry pleuritis, surface of both visceral and parietal become rough, leading to friction. Uh, it can be heard during the auscultation. The referred pain can also seen. Paracentesis mentioned in E5 in this. So thank you. For more videos, please subscribe my channel Earth RX and in Instagram, follow in Instagram Earth RX. Thank you everyone.